Have you ever thought about what happens to your medical reports after you leave a hospital? How do doctors, hospitals, and insurance companies make sense of all that complicated medical information? The answer lies in something that most people don't even know exists: medical coding. Today, let's dive into this hidden but powerful part of the healthcare system. What is medical coding? Medical coding is the process of translating healthcare diagnoses, treatments, procedures, and even medical equipment into universal codes. Imagine you go to the hospital with chest pain. The doctor checks you, runs some tests, and diagnoses you with a heart condition. For treatment, you're prescribed medicines and maybe a small procedure. Now, for the hospital's record, the insurance claim, and even for future research, all these details need to be stored in a standard, universally understandable format. That's where medical coding comes in. Instead of writing heart condition in plain words, coders use a specific code like I-20. So, which represents angina in ICD coding system. Similarly, every test, every drug, and every procedure has a unique code. These codes act like a universal language. Whether you are in India, the US, or Europe, medical professionals and insurance companies can understand the treatment and diagnosis just by looking at the codes. So, in short, medical coding is the language that healthcare speaks to keep everything structured, accurate, and universally recognized. Role of medical coders in hospitals clinics. Now you might be thinking, who does this coding? The answer is medical coders, professionals trained to analyze medical records and convert them into these standard codes. Here's what they do step by step. They carefully read the doctor's notes, lab results, prescriptions, and discharge summaries. They then assign the correct codes for every diagnosis and treatment. They make sure everything is accurate so there are no errors in billing or insurance claims. Think of them as translators. Just like a language translator converts English to French or Hindi, a medical coder converts doctors' handwriting and clinical language into codes. This role is crucial because doctors can spend more time focusing on patients instead of paperwork. Hospitals maintain proper records which can be used for audits and research. Insurance companies can quickly process claims without confusion. Without medical coders, the healthcare system would be slow, messy, and full of errors. Coding as a bridge between doctors, patients, insurance. Medical coding is not just about assigning numbers and letters, it's about building a bridge. For patients, it ensures that the treatments they received are correctly billed and recorded. Imagine if a coding mistake misrepresented your surgery, your insurance could reject the claim. Coders prevent that from happening. For doctors, coding is a way to properly document their medical decisions. This is not only important for the current patient but also for future reference, medical research, and even legal protection. For insurance companies, codes are the backbone of claim processing. They use these codes to decide how much money to pay for a treatment, what's covered under a policy, and what's not. So essentially, coders are the invisible link that keeps the healthcare wheel turning smoothly. Career opportunities in medical coding. Now, here comes the exciting part: career opportunities. Medical coding is one of the fastest growing careers in healthcare. With the increasing demand for healthcare services worldwide, coders are needed in hospitals and clinics, insurance companies, research organizations, healthcare IT companies, even in remote freelance roles. The best part? You don't necessarily need to be a doctor or nurse. With proper training and certification, anyone from a life sciences or healthcare background can become a coder. Growth doesn't stop there. You can advance into medical auditing, medical billing, clinical documentation, healthcare data analysis, and even health information management. And since medical coding is based on international systems like ICD, CPT, and HCPCS, it's a global career. Coders trained in India can work for companies in the US, UK, or Middle East. So the next time you receive a hospital bill or an insurance statement, remember that behind those numbers lies the work of a medical coder, ensuring your healthcare journey is recorded accurately and fairly. Medical coding may not be visible to patients, but it's the silent engine that powers the entire healthcare system. And if you're someone looking for a rewarding, stable, and growing career, medical coding might just be the path for you. If you found this video helpful, don't forget to like, share, and subscribe. Stay tuned for more insights into healthcare, pharma, and medical careers.